Meanwhile, across the country, anti-vaccine protests are becoming a more common sight. Earlier this week, dozens of protesters opposed to COVID-19 public health measures staged a protest outside the Toronto General Hospital. As a result, one emergency room doctor decided to hold his own counter-protest. Dr. Raghu Venugopal. Dr. Raghu Venugopal joins us from our home in Toronto. Dr. Venugopal, thanks so much for joining us. Let's start about asking you why you decided to take this action against the protesters.
Thank you, John. I think it's extremely serious that protesters are targeting hospitals. I witnessed with my own eyes patients needing a police escort to enter and leave the facility. I was particularly enraged because that particular hospital provides some of the best medical care and does some of the best scientific research in our country. It provides outstanding surgical, medical, cancer, and transplant care. And it was particularly egregious to me that that kind of defilement of such an important healthcare facility would happen by very much a fringe group of Canadians.
What kind of response did you get from your colleagues?
I think the most touching moment was when an orderly from the operating room who was watching from upstairs brought me down a face mask and said, "Doctor, maybe you should be wearing this as well, a face visor." The uniform support from high-level healthcare officials like CEOs, like my colleagues who are nurses and patients, was really overwhelming. And I think touched a nerve in the country that the targeting of schools and hospitals is simply unacceptable, is simply un-Canadian, and that there is a better place for people to express their protest, which is at our legislatures and at our parliaments. People have a right to protest, but I respectfully ask them not to do what where people are trying to seek comfort, care, and compassion.
Have you been able to understand what might be motivating these protesters to target hospitals?
Very much so. We know that some of their leaders are now disgraced healthcare providers. We know that the people leading this movement are not allowed to work in health facilities because their licenses are under question. They are facing provincial charges, and furthermore, have had their licenses questioned by their regulatory bodies. So these people leading these protests, let's be clear, are not healthcare workers in good standing and are not the kind of people that you would want caring for you. But they do have knowledge of the healthcare system, and they leverage that really for attention seeking. But the sad thing is, it's compromising the respect and the dignity of those working behind the walls. Those people working behind the hospital walls are not the people that wrote these laws of the land, and they should be allowed to do their work undisturbed and unencumbered by these protests.
Can I ask what it's like from the standpoint of someone who is inside the hospital system and has been inside the hospital system? What's the pressure been like to do the job that you have been doing and your colleagues to save lives, and to know that this sort of sentiment is out there, at least on the part of some of the public?
John, we should be really clear in Canada who this has affected the most. The last 2 years and these protests, I believe, has most affected registered nurses and registered nurses in acute care hospitals. Their salaries are low or frozen. They are asked to extend their hours on a regular basis. They receive the abuse from all of society and take it on the chin on a daily basis. Registered nurses face the most emotional and physical abuse and physical assault by everyone. And so if we're to really put a label on it, the population that has been affected the most, in my opinion, in terms of these demoralizing protests, are registered nurses. And I think as a province of Ontario and as a country, we need to very carefully examine, why are we losing acute care nurses in droves? How do these protests impact their morale? How do regressive antisocial bills like H124 in Ontario affect them? We need to collectively look at that, because, John, tomorrow, if you break your ankle, or tomorrow I have chest pain, it's a registered nurse who is the backbone of our healthcare system, and you can have all the doctors and all the beds you want, but without a registered nurse who are leaving hospitals in droves because of these protests, because of their working conditions, you've got nothing.
The other side of the equation is that presumably there are those who may be influenced by these protesters, who may be reluctant and have that reluctance reinforced by seeing these protests. Can you put it out there why the remaining 20%, arguably the population, or maybe half of that 10%, truly needs to get the double vaccination for all our sakes?
That's an excellent question, John. I'm going to be forthright in saying that I actually don't think this fringe minority protesting is affecting the majority of Canadians who have balanced opinions, who understand science, who can make good decisions. John, I spoke with 20 individuals yesterday who are newly COVID positive. I spent an average of 5 to 20 minutes with each of these patients. This was just yesterday. 100% of these people who were infected by COVID-19 were accepting, interested, open to having a vaccine. We know that even those people that got COVID-19, that immunity is going to go away. And the vaccine provides a much longer period of immunity. And so in my personal experience, meeting people in the emergency room, calling people who are COVID positive, the vast majority of Canadians are open to being double vaccinated. What they need to do is to speak to a healthcare professional, a nurse practitioner, a nurse, a physician, someone who can coach them and guide them and answer their questions in a dignified and confidential manner. Because it's my belief, John, that the majority of our country is open and willing to have a vaccine. They just need some time and space and counseling to get that done.
Dr. Venugopal, hopefully some of those people are listening to you this morning. I want to appreciate your time. Thank you for your time. We really, really appreciate it. Thank you.
Thank you, John.
Dr. Raghu Venugopal is an ER doctor in Toronto.